Hi everybody. So in this video I decided that I would talk about what I do differently when treating cats as opposed to dogs. Often when you think about physio you only think about treating a dog or a horse, but obviously I treat loads of cats and loads of rabbits and various other things as well. What is important that you realise is that every animal's an individual, and us physios will look at every animal as an individual. So dogs are not small horses, and cats are not small dogs, and ferrets are not elongated cats, even though you might think of those things in those ways. There are lots of little differences that we have to make. So I would just, like I said, I just wanted to briefly overview what I might do differently for a cat. So their behaviours are completely different to that of dogs. For them, it's more of a less is more approach. You have to be much more focused on the area. So with a dog, I might spend time working on their bits that aren't bad before I go in for a bad bit, whereas cats you may not necessarily get the same amount of time for, so you may have to be a bit quicker at going to the area. But obviously it depends, every patient is an individual, and some cats are much more dog-like than others, but as a rule of thumb, we're generally much quicker to get to the point with a cat, and you have to kind of let them think that they're in control and they can walk away whenever they like, and so there's no scruffing, no pinning, no holding them down or anything like that. It's very much a mutual respect. You change your body language. You might do things like long hard blinks, because cats find those quite appealing and appeasing and calming for them. What else do I do? I adapt the exercises, so they're going to be much more cat friendly, much more hands off again for what I get the owners to do, and they're going to use much more of the natural cat behaviours to try and engage the muscles in the way that the way that we want them to, so that again it's no forcing or anything like that, which is really nice. And probably the most important one, I always lock the door and I always make sure the windows are closed because we don't want any escapees. But that's it. That's pretty much your lowdown on what I do differently for a cat. Might also use some Felly Whey or something if they really need it, but 9 times out of 10 they're absolutely fine, and I have loads of amazing cat patients who love it. Anyway, that's your little update this week, and I will talk to you about something else next week. Thank you, bye!